Let's talk about this easy situational judgment test question relating to conflict resolution and communication. So, a foundation year 1 doctor notices their registrar repeatedly making sarcastic comments about a struggling colleague. So, we have some level of seniority here, a level of hierarchy, and we want to think about how could the FY1 doctor respond in this situation, choosing the most appropriate and the least appropriate action, with the third one being a null option. So A, should the FY1 say, I've noticed some tension, would it help to discuss how we can support the team? B, document specific incidents in case formal action is needed later. And C, laugh along to avoid being targeted next. I think it's easiest to work out which one is the least appropriate, and that is C. This is being complicit. It enables the bullying culture to continue and does not challenge it. Now, the most appropriate action, we might think that B is the most appropriate, documenting these incidents in case formal action is needed later. But this is not challenging the behavior in the moment, and it is not addressing it immediately. It's a reasonable response, and it's perhaps best to do B alongside A, but it's leaving the behavior unchallenged. So this would be our null option, with A being the most appropriate. Challenging the behavior in a polite, respectful way, it is constructive and primarily focuses on solutions as opposed to being accusatory instead. Let's have a look at this medium level difficulty situational judgment test relating to conflict resolution and communication. So a medical student witnesses two consultants arguing about a treatment plan in the corridor where patients can hear. How important are these factors in deciding whether to intervene? So A, the potential distress to patients overhearing the conflict. The patient experience, the kind of respect that the patients have and the trust that patients have in the medical professionals for their care is absolutely paramount. So this is very important. The student's lack of seniority in the team. The lack of seniority might make it difficult in order to challenge the consultants who are more senior and are higher up that hierarchy, but it should not prevent the student from advocating for these professional standards, particularly when it comes to the patient experience. So this would be of minor importance. C, whether either consultant has a history of being unreceptive to feedback. Now, this is quite important to consider. It might influence how we approach this situation and whether or not the situation may then be escalated further, but it should not stop us from taking any action. So important, but perhaps not the most important thing. And then D, the fact that the argument is clinically relevant. This not important at all. The reason it's not important at all is because even if it is an important conversation to be having, well, it could happen somewhere else. It could happen in a private setting where patients will not be able to overhear, and also could take place in a polite, respectful, calm manner too. Let's take a look at this hard conflict resolution and communication question from the situational judgment test. So the scenario is that during a ward round, a nurse corrects a foundation doctor's medication dose in front of the patient. The doctor appears flustered but says nothing. How appropriate are the responses? The doctor thanks the nurse privately later, but suggests discussing corrections privately next time. This would be a very appropriate course of action. The reason it's very appropriate is because it is professional and constructive, taking place in a private setting, as well is respectful and polite. B, the doctor immediately defends their original plan to maintain authority. This is inappropriate. It is perhaps not awful. It prioritizes it does prioritize patient safety, but it does also prioritize ego over patient safety as well. It's also not an appropriate way to speak to another healthcare professional and kind of undermines that team dynamic. So inappropriate, but not awful. C, the doctor reports the nurse to their line manager for undermining them. This would be very inappropriate. It's an unnecessary escalation of the situation, and it could have just been handled privately. And then D, the doctor agrees with the nurse but rolls their eyes visibly. This would also be an inappropriate course of action. Perhaps not awful, but it's a unprofessional attitude. It's a rude response towards the nurse as well.